No, I'm cool with that.
Yeah, you're okay with that?
We're not cutting this.
Okay. Oh gosh, I never had this question either. So, oh, great. It's not that we're some kind of unicorn that fart glitter. It's that trusted relationship with that one person that you can tell anything to. People assume that, birth is such a horrible thing. Oh, it's painful, it's messy. It can be that, but it can also be really exciting. You people, you were made for this. You don't need pain relief as yet. And that is dangerous.
Welcome to another episode of the Leading Communities podcast. My name is Hugh and I will be your host. And it gives me enormous pleasure to introduce you to today's, podcast. I'm the host.
I'm a guest.
Guest, that's it, thank you.
Guest extraordinaire.
Thank you, see, that was done on purpose. Lorna Phillip, an award-winning doula and the founder of Black Mama's Birth Village, an organisation dedicated to providing culturally sensitive birth education and support for Black expectant mothers. Lorna has worked tirelessly to address the racial disparities in maternal health care and ensure Black mothers have access to safe, empowering pregnancy, birth, and parenting experiences. Whether it's a supportive community, monthly online birth education sessions, or her antenatal program guiding Black mothers safely through pregnancy, Lorna offers all that and more in her mission to help make Black birth better.
Hugh.
How was that?
That was fantastic. That describes all that
Host
I do.
extraordinaire and can't remember what I call you extraordinaire. Look at that. Eh?
Guest,
that's it.
Perfect.
Can you share your journey into maternal health? What led you to become a doula? And how did that shape the creation of Black Mama's Birth Village?
And that's a really good question. So I've always worked with children and families. I started my career as a nursery nurse back in the mid-'80s, before you were born. And
she's very good.
Slick.
That's good. You nailed that one.
Right, thank you. I was a nursery nurse, worked with children, young children and families. In one of my last kind of paid employed roles, I was a Sure Start Children's Centre deputy manager and also the health coordinator for the project. So I'd coordinate all the family health activities like breastfeeding support, stop smoking services, pregnancy support, all that kind of stuff, all that good stuff, which I really enjoyed. But what really struck me was that in meeting moms in the area, they were forever talking about their birth experience.
Are we talking 40 or 30, 40 years ago here? Are we talking?
No, not that long ago. Okay, so I've been working with families now for over 40 years. This was about 2004-5, when I worked for, so about 20 years ago.
Yeah, it's still a good while ago.
And I noticed that they were all kind of like, not all, but there was a theme, this kind of reoccurring theme of disappointment in their birth experience, not very happy with the system that they were under, not happy with their partner's support of them during pregnancy and labour and birth. And my manager at the time, she spoke about doulas, and I didn't know what a doula was, so I went off kind of, looking online, and she was saying that maybe we should start a doula project locally, and maybe then provide the support that people are lacking. And I thought, no, that this area is really needing other support, and I don't think this is the right time or place to have a doula project. So I heard it, and I shelved it. But like many good ideas, it was that kind of seed planted. And it was a few years later, 2012, that I decided it's time for me to train as a doula. And to kind of just put it in context, at this time, I've got my own 2 children, they're kind of teens, pre-teens. And I didn't understand the importance of somebody's birth experience. I just thought you go to hospital, you have your babies, you come home. I didn't realise that actually having satisfaction in your birth experience, or just making sure it's a healthy experience, so that you're coming out, healthy and whole, both you and the baby. I didn't realise actually how important that was and how it can impact not only like just after birth, but for years to come. So I trained in 2012, and I've worked steadily and really quite, hard as a doula ever since. When the pandemic came, we were all worried about maybe not being able to practice as doulas because it was like, you had the one birth partner policy and most people chose their partners or their moms. But actually, it was the busiest period for me. I didn't stop working throughout the whole of the pandemic.
So you're doing stuff that's online, were you?
I was there. I was there at the births. A lot of people chose home births. So I was supporting a lot of home births. Or they were choosing to have a partner stay at home, maybe with an older child, and have the doula go in to support the birth.
Because there's a whole thing about bubbles, weren't there?
There were bubbles, but you were allowed one birth partner.
Right.
So you could choose either your doula or your partner or somebody else.
Right, gotcha.
So I was the kind of birth partner for a lot of births in that period. But I was thinking, well, okay, most of my birth clients were Black and brown women and families. I couldn't do anything more. I couldn't take on more clients because I was actually full with clients. And it's about the time when we heard about the Embrace report that said that Black women, so Black African and Caribbean women, were around 5 times more likely to die in the time around birth. That's just before birth, during birth itself, or just after birth. And I thought, well, most of my clients are Black and brown families. I can't take on any more clients. What can I do to offer some support, but not kind of like burnout? So I sat down with my notebook and pen and kind of scribbled notes. And I thought, right, we're going to start some online support that is solely for Black and mixed heritage women. And that's how it was born.
So what's your current, because you talked about the fact that you noticed that there was this issue. So what are your thoughts at the moment about the current state of birth and parenting education? Yeah, and how are you finding that you're contributing to improving and addressing those particular gaps?
Yeah, so here, there are some really well-established organisations providing birth education, and actually there are more and more coming up now, which is great. We need more. And also many hospitals offer a free antenatal course as well. So that's great. What's often missing from that picture, though, is that centering of Black moms and families and addressing our unique needs.
So what are our unique needs?
Our unique needs are to, A, to be understood, B, to be respected and have some cultural understanding. So when we choose to do certain things during our pregnancy and birth or in our parenting, somebody who understands, somebody who's not going to come along and be disrespectful and say, whoa, what are you doing? Take that off or don't do that, That's really important. But also there's community. And I think we underestimate the power and the strength of having a community of people that actually look like you and also maybe have experienced similar things to you. And it's not about we're all the same, and it's not about we've all experienced the same, but we can have an understanding of each other.
So can you explain the doula process? So what are the kind of things that you have to say, do? We
don't have to do anything. So we are autonomous in our practice. So here in the UK, doulas are unregulated. So there are a few kind of umbrella organisations that maybe support doulas, but we are unregulated largely. So we don't have to do anything. We find our own way of being and doing. And what my way of doulaing looks like is that generally people find you online, so you're pregnant. I've had people that actually aren't pregnant yet who've been in touch to say, when I'm pregnant, can you be my doula? So I say, go away and get pregnant first and come back and I'll let you know. So yeah, they get in touch with you, give some basic details. You offer an initial interview with them for them to find out more about you and vice versa. It's a two-way street. It's important that you gel and mesh, and have maybe similar values. And once you've met and they hire you, there's a contract to sign. There's a payment to be made, generally a deposit to be made, and maybe a payment plan for future payments. And then the work begins. So the work can look like getting to know each other. So, research has shown that having a doula support you in your pregnancy and birth can lessen the number of C-sections, can improve satisfaction with your birth experience, can lessen postnatal depression, for example. It's not that we're some kind of unicorn that fart glitter. It's just that we have this kind of, it's about getting to know each other, it's that trust. It's that trusted relationship with that one person that you can tell anything to. And we don't give advice, we're not clinicians, you know, I can't examine you and tell you what to do.
It's not that you're I mean, if you were a nursery, well, you talked about nursery nursing.
Yeah, but that's not nursing.
No.
We are lay people.
Yeah,
we are lay people.
But if you were a nurse, I'm assuming there are doulas that are nurses.
There are doulas who are also midwives, yeah.
So would they blend together, do they? Or do they have to keep them very, very separate?
You have to keep them separate.
Right, okay.
You have to keep them separate. So we're there to answer questions. We're there to signpost them to information. So if they come with a medical question, for example, I can't tell you what you should do. But what I can do is say, well, here is what the evidence says.
Right.
Okay, let's have a talk about it. Talk with your partner, talk with your midwife and consultant, and make an informed decision for yourself.
So you talked about, we've talked a little bit about systemic issues, haven't we? Like the notion of the fact that, you know, being with somebody that understands you and connects with you is going to help you with an incredibly difficult process in a life, giving birth.
Can be.
Yeah. Mm-hmm. What systemic issues do you believe contribute to the disparities? And what are the health inequalities that you've personally observed in your work?
Yeah, well, let's call out the big one is racism, okay? And people are like, oh no, surely not, surely not. You see, the NHS is a system within the society that we live in. So when you get people that are racist or have racist behaviours and attitudes, if they work in the health system, they don't just take on those attitudes and behaviour like their uniform, right, and stethoscope. Yeah, you're bringing that into your work. You're bringing that into your engagement with your colleagues and with the people, the parents that you should be looking after and serving. So that is a huge issue. But it's not just that. It's not just the racism there. It's the racism that's in the wider system. So the one that keeps us kind of poor, generally, poorly resourced. The jobs maybe aren't open to us that should be, even with, that we're suitably qualified or
level of education
or overqualified and educated. It's all of those systems that kind of work together that keep us in that. Well, it fuels and it drives those inequalities and disparities.
And keeps us oppressed.
It does keep us oppressed. And okay, you'll see people that, have kind of broken out of that. It's not that we're all living in terrible circumstances, but whatever our level of education, our fame, our anything, our wealth, it doesn't protect us from the racism that's in the system. You hear of Serena Williams, who had her baby and was subjected to racism and almost lost her life because of it. Okay, so, being educated and being wealthy and living in the suburbs does not protect you from that.
What are some of the key things you think health professionals should know about supporting Black mothers during pregnancy, birth and postpartum? And how can this knowledge be best incorporated into training and practice?
Well, first of all, they should know that we're human beings. Okay, there's this myth that we don't feel pain like white people, and you've maybe heard stories of Black women in labour being denied pain relief, for example, because they've physically been told, you were made for this. You people, you were made for this. You don't need pain relief as yet. Okay, and that is dangerous. That's a myth, and it's dangerous. And that's what kills. Let's be honest about it.
It's mad, isn't it?
It's completely mad. Do you know, just as we were going into the pandemic, there was something on Twitter I saw, and it was a textbook. It was a medical textbook. And in there, it had a rundown of different people. So you've got Black African and Caribbean people, you've got South Asian people, you've got, I think it's also Chinese people. And it's got this rundown of how we react when we're in pain. And it said something like, well, those, they will kind of over-exaggerate their pain. And those people do this, and those people do that. And it wasn't until complaints were made that book was pulled. That was a medical book to train our medical professionals.
So who challenged it to get rid of that book, do you
I think it was widely challenged. I think it was a lot of and they had to pull it. They had to pull it. They had no choice. But just going to your question of how we can embed, good practice into education, it does start with who are we choosing? I know we're desperate for like midwives and stuff, but who are we choosing? So when people apply, how is that kind of sifting process?
Yeah.
Are we sifting out people that actually aren't suitable to the profession? Or are we saying, you know what, we're a bit desperate, give them a chance and we'll see them at interview and see how they go.
And that's part of the problem in lots of social care professions, isn't there, really?
We're desperate.
We're desperate for people, we're desperate for the right people.
But also the curriculum, what's in the curriculum? Again, did you realise that it's only, I think it was last year, that we started to formally realise that black babies, so there's a condition called jaundice, that babies can have, and it's picked up soon after birth. If it's not picked up though, it can be fatal. And they've only just formally realised that jaundice presents differently in our skin colour compared to a white skin colour. How long have we been here in this country? We've not just arrived, right? But why has it taken all of that time to recognise that this serious condition, it can be serious, to recognise how it looks in a darker skin colour, darker than white skin colour?
I'm asking you. Are you asking me?
No,
rhetorical.
Rhetorical.
Because the truth of it is, we know why that exists.
Exactly. So when it comes to funding initiatives, and we know about these figures now about black women dying, but where is the passion from the government to actually address these inequalities and disparities?
What do you think it is? What do you think is?
I think A, it's because we're black and brown. B, it's because, many of us will say that, we are women, we're giving birth, and really we're at the bottom of the pile for everything.
There's the misogynoir, isn't it? Of the whole, the intersectionality of it. And there's this the notion that if you're black and female, you are therefore stronger and tougher.
It's so not the case.
And it isn't the case. Whilst obviously we live in a world where you kind of think, yeah, it's great to be strong and it's great to be tough, but at the same time, there are moments where I need support and I need people to listen to me. And that is what gives me that strength and that.
And in pregnancy and birth and labouring, you are at your most vulnerable. Okay? You're at your most vulnerable. So, we expect to be taken care of and good care of. We don't need those assumptions. We don't need the racist attitudes and behaviours at any time of our life, but especially not during labour and birth. Because again, the impact of that is it can be very serious.
So because you yourself, you only became a doula in how long? How many years now?
So it's been 13 years.
Okay. And you never had a doula when you were giving birth yourself?
No, I didn't know about doulas back then.
What do you think the impact might have been on your life? That's a
really good question.
Because you talked about the fact that having a doula, it isn't just in the moment itself, it's beyond that.
Yeah, absolutely.
So are you able to answer
I am, and now that I've never been asked that question before, and that's a really good question, but it already comes to mind a load of responses. I would say that I was a young single black mom back in the 80s when I was pregnant. And for example, there were antenatal courses. Yeah. And the one that was
were they quite new age?
No, not really. No, I mean, they were quite well known and quite established. But the one that was the most established in my area where I lived, and they're still going strong now, when I got the leaflet from the hospital with all their information, nobody on that leaflet looked like me. There was nobody A that was single, and nobody B that was black. So I thought, I can't go to that. I'm going to stand up like a sore thumb. I cannot go to that. So I didn't. So I went into labour and birth with my first baby, knowing not absolutely nothing, because I worked in the health profession, but knew very little about labour and birth. So I just handed myself over and trusted that all would be well. And I had some issues. I mean, I luckily had fairly decent births. One was very premature though, and the other not. But I did have some issues that if I'd had a doula by my side that would A, have educated me, and B, probably more importantly, would have advocated for me, then things may have been a bit different.
Do you find that as a doula sometimes you're having to navigate, well, I know the answer is probably going to be yes, but navigating the dynamics within families and the like?
Yeah.
So when you say about being an advocate, are you sometimes having to kind of fight on the behalf of the person against, say, partners?
No.
Do you know what I mean?
I hear what you mean. So I hear what you mean. There's sometimes sometimes, for example,
tensions and stuff.
A couple may will hire you, but the partner may not be so much on board,
Right.
and maybe not really understand the value of having a doula on board. So you could feel as you step into that household, there's a little bit of going on, but our job isn't to rise to that and to be contentious and okay, it's not. Yeah. Our job is really to kind of
not be a little bit
gently, and demonstrate the value and be gentle in our approach when it needs to be. Sometimes though we need to be a little bit more firm, because if we're advocating for the families within a hospital setting, for example, and then they're not being listened to, then we are gentle until we don't have to be gentle, and we need to be a bit more firm with that approach.
How many babies have you helped in the delivery of?
So first of all, it's generally the person or the mom who delivers her baby.
Thank you.
Those around.
Thank you for the education.
That's all right. Part of the team, so a midwife or consultant, they will generally, they support and they probably catch that baby. But moms and people deliver their babies. We are just there to support and to witness and to observe.
So how many of you?
I've lost count a long time. It's been
really?
a whole heap.
Yeah.
And I get the photographs now saying so-and-so started school, and they're there lined up against the wall, up against the door with their too long, blazer sleeves, and it's quite a joy to see.
That's fantastic. That's fantastic. You were diagnosed with ADHD later in life, weren't you?
Yes, I was.
So how has your diagnosis shaped your approach to your work as a doula and as a advocate?
Gosh, I never had this question either. So, great. I don't think it's changed my approach. I mean, this is something you're born with, and it's kind of, I guess, given me more of an understanding, understanding how I engage with people, understanding what supports me and work and personal life. So certain things that don't support me, so kind of like, being kind of slogging my guts out for hours and then without a rest doesn't support me at all. Being in crowds of people for extended periods, yes, I can do it, but it means I need like a whole week to recover, for example. So I now know how to kind of factor in those rest periods. And I know how to kind of diary my work in a way that supports me and how I best operate.
What unique challenges might a neurodiverse mother face during her pregnancy, birth and parenting?
Yeah, good one. So again, it's that because in the system, when you're pregnant, you may see a different person at each appointment. It's quite, things are changing slowly and awareness is being raised, but it's hard then to make that relationship. It's hard for anybody to make that relationship, but it can be super difficult to be able to relate to people if you're seeing someone different at each appointment. Sometimes it's the understanding of the information and the way the information's been given to us can be a bit of a barrier as well. Not being able to ask the questions or not knowing what to ask can be a barrier. But sometimes it's just that sensory stuff that goes on. So in labour, you may be in a room like this that's really well lit, for example. We now know that actually if we turn down the level of the lights, birth tends to unfold more smoothly and more comfortably, and that applies to anybody. It could be a sensory thing for things that they feel or how people touch them. So to be aware of that and make sure that people around them know that, and then they can best support them during that process. That's really important.
What steps can healthcare professionals take to provide better support in these areas, do you think?
It's about getting to know people, isn't it? It's about not having those 10 minutes for your appointment, you know. And it's not the midwife's fault, it's the system that doesn't allow for that getting to know each other, okay? Where that happens really well, though, is actually in home birth. So when you have a home birth team supporting you during pregnancy, they have more time to get to know you in your own environment at home. You may have your antenatal appointments in the home, and that's really helpful. So it's that giving people time to talk, ask the questions, and not shooing them off because, oh my gosh, I've got 10 more people to see in the next hour.
And do you think that's irrespective of being a member of the global majority or not? Do you think?
I think everyone,
every woman faces that.
I think these issues actually are faced by all people, but there's an extra layer when you are black and brown.
What actions should local and national authorities take to better tackle health inequalities in maternal care for black mothers? And how can they ensure these efforts have long-term systemic or seismic impact?
Well, first of all, we need targets. We hear about, so many reports being written. It's like, stop the report writing now. Let's see some targets. Let's see some kind of time-bounded targets, because we can't wait any longer to see like systemic change. Let's see funding, because a lot of it is around funding and the lack of resources. So a lack of qualified midwives, a lack of finance, a lack of time.
So when you say, sorry to go back a little bit, you say targets, do you mean things like, would the target be how many successful births, but also successful births? And what is a successful birth?
Let's bring down, the stats. The stats, there are stories behind these stats. You hear about, you're four more now like to die as a black and brown woman. But there are stories behind these stats. There are people behind these stats. We need to be bringing these stats down. We need to be improving the experience for women and families and for babies. So it's about resourcing healthcare in a way that will then have a massive impact on these stats and on these experiences and on these deaths, let's be frank.
Beyond your work at Black Mama's Birth Village, what other initiatives or ideas do you believe can contribute to making black birth better in the UK?
Well, I've also got a CIC. I have a CIC called Babes in the Wood CIC, which I started about 4 or 5 years ago. Didn't really do much with it. It's been dormant until recently, when I got some funding to put on a health event for parents or parents-to-be, which was 2 weeks ago. So we had what we call the Big and Bougie Baby Shower event over in Edgbaston, in a big manor house in Edgbaston, where we invited local parents-to-be of all ethnicities, but actually African Caribbean ones, the ones who came. So we had a beautiful safe space where we could, we had lovely food, afternoon tea, jerks, chicken wings and everything going on. DJ, all the kind of stuff. But most importantly, we had a panel of NHS midwives. And we had a couple of Q&A sessions where the parents could actually ask questions and get the answers that they're looking for. So this wasn't a rushed thing. This was a nice, relaxed, safe environment where you could actually talk to local midwives about the kinds of things that are worrying you or concerning you. And I think it will take that kind of collaboration between the NHS and the third sector to reach more families, to give those really important health messages, and for those messages to actually stick. Because we get thrown a pamphlet or we get told something, but
we think that's enough, don't we?
No, it's not enough. It's rushed. It doesn't quite speak to us, that piece of paper.
Go to that website.
Go to that website and have a look for yourself. Well, no. Can we not create these spaces where we can come together and have these really important discussions?
And that's what Black Mama's Birth Village does, isn't it? Because you were talking. So how does it? I mean, have you got other doulas working with you? Or is it just
not yet? I will do those. That's my next step, because I need to kind of slightly remove myself from the day-to-day kind of operational stuff.
So is the day-to-day like a discussion group? Is it?
Day-to-day, we have a Facebook group of over 400 black and mixed race moms, which I started just over 4 years ago this April.
Happy birthday.
Thank you very much. a space where I thought they'd come in their pregnancies, they'd, make use of the community and what's in there, and then toddle off and leave the group. But we've got now moms on their third pregnancy in there, and ones that now got toddlers but are staying there, because it's that community vibe that's really, really important.
And we were talking before about the wise woman in the village who had that special knowledge and was able to support. And there you have it, isn't it?
Wise.
The wise women in the village who,
and
if it 20 years' time,
yes,
will still be there.
And the thing is, what I love, Hugh, is that I don't have to be in that group for it to be successful. What happens is one of the moms will post a question or a comment or a rant or an experience. And what I love is the other people in that group will literally form a circle around. And they will be like, oh, it's okay, hun. This is what happened to me and this is how I handled it. It's that peer support that I think is really like the chef's kiss of this.
It's really easy because, with the internet, and people will write something like, something really cryptic about their day and experience that they've had. And then you'll have this like whole litany of like, if you're okay,
you're
hon,
right, babe.
You're right, babe, and all this will go on, go on and go on. And in some respects, one realises that people are being genuine in the support they're giving.
Yeah.
But we all know that real support comes from almost like a more practical, energised application, isn't it?
Yeah.
It's not enough just to kind of write some words on it.
You're right, hon. No.
I know, it's picking up the phone and ringing them. It's going round to the house. It's sending a personal message of care.
It is.
Saying, if I'm here,
I'm
here.
Yeah.
And because I've done that where people have posted things, and I've not put it on a public forum, but I've messaged somebody privately and said, I've read this.
Yes.
Do you want to go for a coffee?
Yeah.
Or when are you free to hang out? Or what do you need me to do?
Absolutely. And we have these impromptu picnics, go to Camden Park, where we're just kind of like, everyone brings a dish, brings your rugs, brings the kids, and we just have an impromptu picnic and all these, lovely things that actually, when you go to other groups, you join lots of mother and baby groups, parent and baby groups, and they'll often come back to me and say, Lorna, I went to that group and it was nice, but there was nobody there that looked like me.
You just hold that pause for a little bit.
Yeah.
Tell me some of the positive changes you've seen then, and some of the success stories that you've seen over your time.
Oh my goodness.
Because I know you mentioned about the one success story, of course, is people sharing with you what their kids are getting up to.
Yeah.
That you've been there.
Yeah.
So tell us some positive stories.
There are so many. So in my doula life, I would say it's you see the parents blossom. So people assume that when you're a doula, it's, you must love babies. They're all right. Babies are all right. But you know what I mean? No big shakes for me. It's about the parents for me.
Yeah.
I'm not the parent, so I'm not like, with this baby. I want to support you so that you can look after your baby in a way that feels wonderful and whole for you. So it's seeing that people having the birth of their dreams can be a wonderful thing. People assume that, birth is such a horrible thing. Oh, it's painful, it's messy. It can be that. Of
course.
But it can also be really exciting. Dare I say it, if you want to cut it out, it can be orgasmic for some people.
No, I'm cool with that.
Yeah, you okay with that?
We're not cutting this.
Okay. It can be that great an experience. And I've been to births where the women say, I want to do that all over again, straight afterwards. And, you don't see that on films and stuff. You see all the...
And then afterwards you get the...
Yeah. So actually, I get to see that, which is wonderful. In the village itself, obviously I'm not there at their births. I have been at some of their births as a doula, but I'm not there to be their birth doula. I see the benefit of community. I see, for example, there's things that they've asked, like, for example, my midwife says, I have to do this. Do I have to? And we all know, hopefully we all know, that everything that is offered is an offer and it's not mandatory. And so even just telling people that, like, oh, I didn't know I could decline that. I didn't know that. And even that itself is a big, big thing.
It must challenge your own beliefs, though, at times. I mean, it's always an education, I would say, but I would have thought. But it must challenge your own beliefs at times. There must be times where you've been with somebody and you thought, you know, for want of a better term, it's textbook. And then there are other times where you're thinking, God, I wouldn't do any of this myself.
Yeah, absolutely. And there's a whole wide range.
I mean that irrespective of culture.
No, absolutely. No, across the board, there's a whole wide range of how people birth, either how they choose to birth or how birth ends up in the end. And of course, not everyone's going to do the same thing that I want to do, I would have done, for example. And it's not about me, though. It's about them. And it's about supporting people's choices unconditionally.
And I suppose sometimes part of the work of an advocate, of a good advocate, is somebody that will say to somebody in a way that is palatable that I don't think this is the right decision for you to make.
I don't even say that.
Not at all.
No. Let's look at the pros and cons. We say, let's look at the pros and cons. Let's see, you know, what could happen. And so long as somebody has the right information and the correct information, they make their own minds up.
Because the primary thing is the health and welfare of that child that is born and the health and welfare of that person that's giving birth.
Absolutely. I mean, we often forget the person who's giving birth. It's like almost like they're a vessel, an empty vessel that's just grown this baby and is going to birth this baby. You know, they are an important person in their own right too.
What advice would you give to black mothers navigating the UK healthcare system? How can they advocate for themselves effectively while dealing with potential biases and barriers? And I would argue, I would assume that you could always draw on the experiences like yourself of what you faced on your own. Well, when you said that you were kind of isolated.
I would say knowledge is power. I would say learn. You haven't got to go. Thing is, there's so much online now. So many Instagram accounts and TikTok accounts and all that malarkey, okay? You could so confuse yourself with all these things that people are telling us, these gurus and experts. I say find 2 or 3 that you think, this person is making some sense here, right? It's not sensationalist, it's not, foolishness. Find two or 3 and follow those. Read a decent book. Ask people who've birthed recently and maybe a few years ago about their experiences, okay? You can find out so much from different sources, but just be mindful that in this age of social media, there is an awful lot out there that maybe is not steering you in the right direction. It's all for the show.
It'd be great for you to share, and apologies if you've done this already, but share the experiences on, like a BBC website or something about the plight of black mothers and what they have to face, because I do think it's it is about combating this myth. There
is a lot out there already, which is great, and more coming. There is a little film coming possibly in July. We've got a screening in July about a birth that I attended about a year or so ago,
right, okay.
And we're hoping that will kind of make it to iPlayer, hopefully.
Brilliant. When you say it's a documentary
style, yeah.
Okay.
There's a lot out there. There is a lot out there. It's just for you to kind of people to go and have a look and have a read and to kind of educate themselves on what's going on. And also I've got to say that it's scary for us black and brown folk who are pregnant and going through this journey, seeing and reading all this stuff about, deaths and the stats and the stories. It can be really scary for us when it actually should be a joyful time. You're bringing forth a new life. I will say that actually black birth does work. There are awful experiences, yes, but I've seen many a joyful black birth. So black birth does work under the right circumstances. It can work beautifully. So don't think that, oh my gosh, I'm destined to be one of these people that has had a terrible, terrible time. It doesn't necessarily follow, but it's important to get that knowledge.
What's next for you and the Black Mamas Birth Village? I mean, you just kind of alluded to the film that could be happening. So are there any upcoming initiatives or projects that you're excited about?
I think I'm going to be doing this event that I did 2 weeks ago for the CIC. It was such hard work. I thought, there's no way I'm doing this again. It was going to be my first and my last event.
You were going into it thinking.
So that was yeah. Well, yeah, I was, because it was a lot of work. It's hard. It's stressful. But now it's been done, and it was a great day, and the feedback has been absolutely tremendous. We're looking at doing some future events under the CIC. I am looking at how we're going to take the birth village and what we're going to do, bringing in some doulas to manage the day-to-day kind of running of the Facebook group, for example. So that releases me then to do other stuff and some more developmental work. But watch this space is what I'll say.
You don't want founder syndrome, do you?
What's that?
So founder syndrome is the notion of that, because you set something.
Oh, I'm the only one who can.
You're the only one.
Oh, no.
No. It's about true empowerment, isn't
Absolutely,
it? Really?
Absolutely.
So you mentioned about, reading a couple of books and stuff. Mm-hmm. Are there any books or resources you'd recommend for anybody interested in learning more about Black health, pregnancy, maternity, and the like?
There are a few. Yes, there are. So we've got out there. We've got an IG account. An organisation called 5 Times More, who are wonderful. We have the Motherhood group, who are prolific online, have their own app, the Black Moms app, I think they called it, out there. You've got me, of course, and we've got our own app, of course, out there, and many, many others. But that's a good place to start, actually.
So, brilliant. I don't think I've got any more questions.
You've got no more questions?
No, it's just been nice hearing. I mean, this is such a massive issue.
It's huge.
It's a huge, huge issue. And I know that people can sometimes feel they're a bit bombarded by, the slings and arrows of life and the like. Mm. But we've got to keep all the plates spinning, haven't we? And we've got to keep this one spinning. We've got to make sure that people are aware of what's going on in the world, and especially this, dispelling the myth that, Black mothers do not need that support or care when they're going through possibly one of the most difficult but beautiful, like you said, can be beautiful moments of their lives.
Mm-hmm. Absolutely. And things, everyone needs to know it. People maybe assume, well, I'm not Black, I'm not mixed race. What do I want to know that for?
Yeah, well, that's actually, the other problem,
Hugh,
isn't it?
If we get it right, this is not a new thing, if we get it right for Black and mixed race moms and families, we get it right for everybody.
Lorna, thank you again for the education.
You're welcome.
Thank you very much. I think you nailed that.
Thank you so much, Hugh.
We were talking about nail care earlier. That's why I was trying to say the word nailing. So I've done it a couple of times. If you watch the whole thing, you can count and write in the comment section how many times I said the word nail. There you are.
Again.
But Lorna, thank you so much for joining us today. It's been absolutely fantastic.
I loved it.
And hopefully see you again soon, folks. And take care and enjoy your day.